Council on the Economics of Health for All, but she is also professor in the Economics of Innovation and Public Value at the University College London, where she's also founding director of the UCL Institute for Innovation and Public Purpose. So we have 30 minutes for this press briefing, which is really going to focus on the Economic Council's new financing brief. And the timing of the brief is quite important as we have the G20 meeting coming up later this week. Following the remarks from Dr. Tedros and Professor Mazzucato, we'll have time for some media questions. When I come to you, to the Q&A, I'll ask you to raise your hand in the Zoom and write in your name and the name of your outlet so we know who you are and can call on you. We will be taking questions on the council and the brief. If you have unrelated questions, we have a presser planned later this week on broader COVID topics, and you can ask unrelated questions at that time. So without further ado, Dr. Tedros, the floor is yours. Thank you.
Thank you, Gabi. Dear colleagues and friends, today I'm pleased to join you for the presentation of the second policy brief by the WHO Council on the Economic of Health for All. We're joined by the Council Chair, Professor Mariana Mazzucato, who has led this distinguished group of diverse experts from around the world in their important mission. Their new brief on financing health for all comes at a critical time with the upcoming G20 summit in Rome, where Professor Mazzucato will present the Council's findings. It's important to start by defining health for all, and I would like to quote one of my esteemed predecessors as Director General of the World Health Organization, Dr. Adhanom, who said, health for all, I quote, implies the removal of the obstacles to health. That's to say, the elimination of malnutrition, ignorance, contaminated drinking water, and unhygienic housing, quite as much as it does the solution of purely medical problems such as lack of doctors, hospital beds, drugs, and vaccines, end of quote. A landmark commitment to health for all was made at the Almata Conference of 1978. And more recently, there was the high-level political declaration on universal health coverage at the UN General Assembly 2 years ago. In the face of these powerful commitments, huge challenges remain. The COVID-19 pandemic has thrown a harsh spotlight on the inequities both within and between countries. This includes the vast disparities in vaccine allocation, where just 1/4 of the 6.7 billion vaccine doses distributed globally have gone to lower middle income, to lower and low income countries, although they make up more than half the global population. Addressing the structural inequalities that keep us from achieving health for all is not a job for the health sector alone. The COVID-19 pandemic that has taught us that the impact of health crisis resonates throughout economies and societies. It's clear that this goes well beyond the health ministry. Ministries of finance, trade, labor, infrastructure, environment, and so many others, including heads of state, including international financial institutions and the private sector, must be at the table, must take responsibility and tackle the great challenge of health for all together. We need a new narrative. We can no longer see health as a cost, but as an investment that's the foundation of productive, resilient, and inclusive economies. The task of the Council is not only to come up with innovative economic approaches to improve health and well-being, they must also be practical and applicable to countries of all income levels. The Council released its first brief on health innovation this past June. The new policy brief released today on financing health for all proposes a radical shift in economic thinking for global health. Instead of looking at health as a piece of the economy, it's time to look at how the economy can support the societal goal of health for all. This new finance brief shows that neither existing market mechanisms, with their focus on short-term returns, nor development funds alone are enough. They do not provide the global public goods on which we all depend, such as vaccines, nor do they address the major inequities undermining equitable access. The Council is proposing bold, concrete actions for governments and multilateral organizations in three major areas: creating fiscal space, the direction of investment, and the governance of public and private financing for health. This does not just mean more money. It means making the better, smarter, and sustained investments that are needed to achieve health for all. So more money plus better money, not only the quantity, but also the quality. It's time for a new paradigm. We have to consider financing for health as a long-term investment, not as a short-term cost. My thanks to Professor Mazzucato and all Council members for their work. I hope that this powerful report reaches policymakers in all sectors and at the highest levels. Thank you, and Gabi, back to you.
Thank you, Dr. Tedros. Now we're going to turn to Professor Mariana Mazzucato. Mariana, the floor is yours.
Great. Well, thank you, Gabi, and thank you so much, Dr. Tedros, for your leadership and your words that you just had for the WHO Council on the Economics of Health for All. This is, as you said, our second output. The first one was really, and how can we innovate towards the common good? How can we structure the mechanisms of production and innovation itself in order to actually reach the Health for All objective? And this one is really focused on financing mechanisms on the back of the G7 meeting and the upcoming G20 meeting this week, when finance ministers and health ministers talk about what needs to get done. We're a council currently composed of 10 women economists from all 5 continents. We're about to let in some men. I hear that Gordon Brown is on our waiting list. The women themselves are myself, Sinead Fiseha, Jayati Ghosh, Vanessa Huang, Stephanie Kelton, Ilona Kickbush, Zelia Maria Profeta da Luz, Kate Rayworth, Vera Songway, and Marilyn Waring. And we formed the council in May, and we are quite driven to make sure that the messages come at the right time. And again, this is an incredibly important moment to make sure that we're not just filling the system with finance and with liquidity, as we did after the financial crisis, when most of that finance just went back into the financial sector. How can we make sure the finance actually lands in the real economy, strengthens global health systems, but also that the financial structures themselves are redesigned, because we have to learn the mistakes from the past. And really, this is the core point of the council. We don't think that there's been any lack of thinking about the relationship between health and the economy. The problem is that often the logic has not been the right one. The logic has been invest in health and it's also good for the economy. We say no, invest in health for all. That's the mission. And then backtrack and ask, what does it actually mean for all the different types of economic structures and the social and economic kind of fabric of society? What does it mean for how we govern innovation, how we direct and restructure finance, how we use tools like outcomes-based and participatory budgeting, how we can use it to really drive innovative procurement. Procurement budgets are huge within every single government in terms of the percentage of government spending, and yet it's often a static instrument instead of a dynamic instrument fostering new solutions for public goals. And what does it also mean in an era like the one we're living in, where there's these huge recovery funds and also bailouts for different types of companies? How can we create a real kind of conditionality at the center of that creation of money so we truly do what the world is talking about, which is building back better or building forwards better? And as with climate, the cost of inaction is actually greater than not acting today. And that really requires seeing the kind of investments that we talk about as investments in the long run and not costs in the short run. By cutting costs today, we're going to create a huge mess that's actually going to cost us more later. And so what does it actually mean to build back better? Well, one of the things that we're very clear on in this moment, where there is a call for more finance, is that we really, as Dr. Tedros already highlighted, have to be careful. We have to better understand how the current structure of the financial system and of the economic system got us into this mess in the first place, including also the climate crisis, the health crisis, the financial crisis. And on that, however, we should also be pushing for more finance. We're not just going to say that we need better finance, but on the more finance, it's very important to listen to the G20 report of the high-level independent panel, which currently is calling for an investment in pandemic preparedness as a global public good. Such an important concept. I'll repeat it, a global public good. And they call for a minimum commitment from governments for pandemic prevention and preparedness to be at least $75 billion over the next 5 years, in addition to, not instead of, existing development support via ODA. Now, what our council says is yes, 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 we have to increase the finance. We have been starving global health systems. However, we have to do it in new terms. Finance and financial structures are not neutral. They're not just greasing the world, of commerce. How we structure the financial systems and the public-private partnerships actually matter, and they affect the direction where the finance actually goes and also the outcomes. And so we really believe that the existing paradigm of economic thinking itself needs to change. This is why we brought together these amazing women, many of which are actually professors of economics, to really ask what is the new economic thinking that also needs to be underpinning better economic policy. And a lot of the problems have been that the focus on short-termism, which has then led to cost-cutting, profit maximization, has also really dismantled vital capabilities on the ground that have undermined the strengthening of health systems and the social determinants of health. And so we can't just continue to put in vast amounts of money without actually questioning what has gone wrong and how can we improve it, and these deep structural issues that need to change. And so we set basically 3 different pathways that we think are crucial for rethinking the structures of the financial system itself. And I'm going to briefly review those. First, we argue that we need to stop saying that there's no money, right? We need to actually create the fiscal space for health for all. And we can't do it when it's too late. Money has come out of the woodwork during COVID-19, but it's too late if we are not continuously investing in all those very important areas that then lead to the mission of health for all. And we argue that internal constraints on government budgets are not insurmountable, and governments have always actually more room for increasing the fiscal limits on investments for health than they're led to believe. And it's not just a matter of political choice, but also one of political will, whether a country can mobilize all the resources and levers it can to maximizing financing for health, such as innovative monetary policy, but also, as I mentioned before, procurement policies, using all the different levers, grants, loans, procurement, to really catalyze new solutions that we need for health for all, which has to be the objective itself. And the bottom line is that countries must reverse the harmful effects of an austerity approach to public administration and public finance reforms. And it's quite interesting, if you look around the world, the countries that have fared better have also fared better. If you look at, for example, Kerala, a region in India, did better based on those investments that it made within its public administration. And there's indeed an external constraints, almost false constraints that have been imposed on governments' fiscal spaces, often by, and let's call it out, multilateral organizations like the IMF and the World Bank. And actually the IMF has put out some very important writings in recent years saying actually austerity didn't work. And it itself has to change in terms of what kind of conditions it puts on the loan. So let's remember that kind of mea culpa call that we've seen in recent years with some very important papers that have come out of the IMF. The rules of the game are a product of what is often called the Washington Consensus. And some are, these are really no longer fit for purpose, and they must change to create a much more enabling fiscal environment for long-term equitable growth and enable social spending to improve individual and collective health security and ensure progress towards health for all. And specifically, we also propose multilateral organizations should negotiate debt relief for low and middle income countries in such a important moment like the one we're living through, redirecting special drawing rights towards investment in health and especially vaccines, push for enforcing a minimum global corporate tax of at least 15%, and advance the G20 reform of sovereign credit ratings. So that first area is really, again, creating the fiscal space and going beyond the myth that there's no money. When we go to war, money is found. And during a health pandemic, money has been found. But that is too little and too late. We need to rethink the myths themselves. Second, we need to direct investments towards health for all. To reorient economic activities around health, we need to forge symbiotic public-private relationships. We need business, we need public actors, we need philanthropies, but they need to work together in a different way. And a way to do that is really to bring together some conditionalities at the core of a new social contract. So conditionalities, incentives, and regulations which have the objectives themselves at the core. And this can be done by redesigning the terms and the conditions, structuring contracts, grants, transfers, loans, and partnerships between public and private actors. And what we focus on also in the first brief on innovation is that this point is particularly important in health innovation, precisely because the public sector puts in so much of the money, especially in the early stage when it's more risky and more capital intensive, uncertain. So these critical market shaping public investments should surely ensure conditionalities around pricing to make sure that we have access at the core, that we have vaccines that are globally accessible, but also how we structure intellectual property rights that truly reflect the public interest, including the possibility of consistent and long-term financial return and ownership of research. In other words, that we also share in both the risks and the rewards, instead of what we often find, which is socialization of risk, but privatization of rewards. And that issue of structuring intellectual property rights is important because what we in the end want with innovation is collective intelligence. And so making sure that patents are not too wide, too strong, hard to license, and too upstream are core ways to govern the patent system. It's not about getting rid of patents. We have to govern innovation and the patent system with objectives in mind. And more broadly, we need to shape a conducive regulatory, tax, industrial, and economic policy environment and create a normative framework to crowd in all sorts of different sources of finance at the same time, ensuring that we get the greatest multiplier effect, the greatest impact on health for all. And only a truly global end-to-end health innovation platform governed collectively and shifting from a model where innovation is left to the market to a model aimed at delivering global common goods, again, a very important word, that has also been used by the independent G20 panel. And third and lastly, we say that we need to govern public and private finance for health for all. Private finance has been an important source of financing for health products and services, but we need better regulations of private finance to help to ensure that health markets are better aligned with public health imperatives, including universal access to good quality provision, prevent excessive charges and rent extraction through monopolies, and as already discussed, setting intellectual property rules that do not inhibit critical access and innovation, reducing information asymmetries and preventing conflict of interest. And a key action point right now, given the gross inequity in the vaccine distribution, which Dr. Tedros has sometimes called vaccine apartheid, and a huge moral failure in the global system, is to redouble the efforts to strengthen and invest in existing mechanisms for global vaccine distribution like COVAX and technology transfer, for instance, the COVID-19 technology access pool, or as needed, transforming them and the ways they are governed to be more inclusive and able to deliver health for all. So can I just, again, thank you, Dr. Tedros, for your leadership. Thank you for allowing us to set up this inspirational panel. We will continue to put out outputs. Our next one will actually be on value. And it's quite important right now that while we have these calls by the IMF, the World Bank, the G20 and the G7 for increased financing for pandemic preparedness and response, we have to constantly remind ourselves that more money is important, but it's not enough if we are to change the underlying economic thinking, policies, and inequalities that keep getting us from one crisis to another. So thank you very much for your time, and happy to answer questions.
Thank you, Mariana. Thank you, Dr. Tedros. Journalists, please raise your hand in the Zoom if you want to ask a question. And again, put your name and the name of your news outlet. We have a few minutes left. And while we're waiting for hands to be raised, I'm going to ask you, both of you, or whichever of you would like to take the question, a question that really reflects a lot of discussion in media and in social media, which is, during the pandemic, there has been, as you alluded to, very relatively little progress in equity and financing issues along the lines of what the Council is proposing. And the brief that you've summarized is very idealistic, and it proposes really transformative steps. But given the fact that the market economy is so deeply embedded in most powerful nations, is a radical re-engineering really possible? Don't you think that after the pandemic, capitalist societies and most powerful private and public sector leaders and players will just go back to their old ways, will revert to the same old, and the new social contract you propose will just be left behind?
Should I take that, Dr. Tedros? We can do it together. Maybe I'll start. So it's a really good question. And, part of it is also, I think there's two parts to your question, which is, are we going to go back to the old way? And, the answer is we can't afford to. But the bigger question is this just pie in the sky? And is this just kind of some sort of utopian ideal? And I think the answer is no. And this is why the second year actually of the Council, this is still just our first 6-month period, is really going to be focused on implementing these ideas. And one of the ways to do that is actually to start working with different partners globally who have already begun, but just in too much of a peripheral way, to experiment with new structures of finance. It's quite interesting, even with the COVID-19 recovery funding globally, some countries like in France were quite, bold in putting strong conditions attached to the money that flowed, for example, to airlines and the automobile industry. They had to commit to lowering their carbon emissions over the next 5 years in order to get that public subsidy. And there's something about that conditionality that we need to be just normalizing. It shouldn't just happen in a period of crisis, precisely because the sector, the health area, has so much collective effort and collective value creation. What does it mean to design within these partnerships goals and conditions attached? So we don't just use the word the market economy, but actually remember that markets are outcomes of how we govern all the different actors, but especially how we govern the relationship. And that's why in the brief, we talk about mutualistic and symbiotic relationships, and not what, frankly, sometimes in the health area, sometimes is a parasitic relationship. Look at the United States, where you have $40 billion a year going in by the National Institutes of Health and Health Innovation, and somehow the intellectual property rights don't, get governed with respect to that. The pricing of the drugs, again, don't take that into account. So this is actually a global phenomenon that, because health is so important, we think that it's enough just to put money in without then governing it to make sure it actually benefits people. And another just example I'll bring out is the military. The military also invests in health. Soldiers get sick in the war, but because we put war as an urgent battle, to win, somehow, organizations like, again, in the US, the Department of Defense and DARPA when they fund medicine, they make sure actually that the soldiers get access to the medicine that they actually finance. It's because we don't treat as urgent or social problems that we don't actually get real to make sure that we have global access to these innovations that we're financing. And so I don't like to use the military as an example because I don't think we can rule by fear, but it's interesting that when we put our minds to it and actually treat things in an urgent way with what I call a mission orientation, we can learn a lot about what has happened in other sectors. And we need to use COVID-19 as a real wake-up call to do things differently.
Great, thank you. Anything to add, Dr. Tedros? We do have a question from...
I think Mariana had already said, but the pandemic is, unprecedented. And if we're going to learn, if we're not going to learn lessons from this, I think we will repeat the same mistake. This COVID pandemic has affected the whole world and actually taken the whole world hostage, and destroyed lives and livelihoods, affected our social fabric, impacted our politics, economy. I think the world should come back to its senses and learn from this and implement. Gabi, you said this is idealistic. I wouldn't say that. I would say this is the right thing to do in order to prevent the next pandemic and prevent all the crisis that's happening now. Still, it's happening, by the way. And it has shown health is central, and it should not be treated as a cost, but it should be treated as an investment. So everybody has seen it now. There's direct experience. And I hope the world will listen and act. And these recommendations, especially the 3 pathways, are very clear. We're creating a fiscal space and directing investments to health for all, and also governing the public and private sector. The commitment to health for all has been there since the establishment of WHO. And the end of 1940s. In our constitution, it's clearly put there. I think the world had agreed even then, but I don't think it was serious enough. Probably the lessons we have learned now will still the same health for all, nothing has changed, but I think we'll now add seriousness into what the world agreed in the 1940s. So health for all is the answer. And I think we have learned our lessons the hard way. And we have to listen to the council that's already proposing the pathways to a better world. Thank you, Gabi. Back to you.
Thank you. We have a question from Andanaya Usher of Development Today. Can you unmute and ask your question, please?
Yes, hello, can you hear me?
Yes.
Thank you. So you mentioned COVAX in your presentation, and you mentioned one of the recommendations of the G20 report on pandemic preparedness to invest at least $75 billion over the next 5 years, in addition to ODA. What I'd like to ask you about is, in 2 days, the ACT Accelerator, of which COVAX is a part, will launch a new strategy and budget for 2022. I have not seen the final version yet, but the total bill for high-income countries will probably be in the region of $40 to $50 billion if we include the funding gap from this year. The argument has been made by the IMF and WHO and many others that it makes economic sense to help low and middle income countries out of this pandemic, and yet ACT Accelerator remains badly underfunded. So what arguments can be made, in your opinion, for high-income countries to make this funding available and in a timely fashion? Thank you so much.
Thank you. Which of our distinguished speakers would like to take this question?
I mean, I think you gave the answer in your very eloquent question, which is that, of course, the high-income countries have to be helping the low-income countries. One of the things that we talk about in both briefs is that we also need to, at least in the long run, better understand why it is that the capacity on the ground in the low-income countries has become so weak. How can we actually change the business models, the way we innovate, and create industrial capacity globally, precisely so we have to rely less on charity in moments like these. And so even though immediately we need solidarity and we need the high-income countries to do exactly what Dr. Tedros set out in his early remarks, I think in the long run, we have to realize that this, donor mentality is actually part of the problem, and that lots of the conditionalities that were set in the past on the loans provided to developing countries precisely made them weaker, actually. And, they weren't allowed actually to create that kind of fiscal space that we highlight as the first key kind of pillar. And so over time, because this will not be the last pandemic, as the permafrost melts, apparently there's going to be all sorts of other viruses that come about. So, climate change and this health crisis are really interlinked, unfortunately. So we have to be better prepared, and that preparedness needs to be a long run preparedness that really is built on the ability to have a distributed, manufacturing capacity and industrial capacity globally. And, focusing on the continent of Africa, I think is going to be extremely important in that light. And that is why we call out things like the Washington consensus conditionalities that actually led to that weaker global system in the first place. So I would say that your recommendation is exactly the right one. And it, again, echoes what Dr. Tedros mentioned in the beginning, but it's not enough itself. Otherwise, we will constantly have to rely on someone filling the gap, and a donor type mentality, which unfortunately doesn't actually make the global economic system stronger in a distributed way.
Yeah, thank you. I think it's covered, but just one dimension. I mean, we were discussing about the ACT-A financing plus, the G20, be 25 billion or 50 billion US dollars. And I think the world knows also how much money it's spending on austerity, trillions. And some finance ministers said what ACT-A is asking is actually a rounding error for many countries. So, 75 billion for 5 years is really small, not really big comparing it to the austerity funding, which we see in especially high-income countries. So is it because of lack of money? I don't think so. It's not. Then what it is? I think many colleagues during this World Health Summit has been saying it. Yesterday also we had a meeting. It's lack of commitment. There is no real commitment to really act. Based on the recommendations, implement and then get the necessary result that we're expecting. It's actually very disappointing that the ACT-A is not fully financed because as the ministers of finance said, it's a rounding error, the amount of money which is being asked. And collectively for those who have the resources, it's actually even small because no one is expecting the funding to come from one country or two or three countries. It's from all that can afford to contribute, especially the high-income countries. It's again, if there is commitment, real commitment, there is a way. Because you asked me, how can they finance? What are the mechanisms? A mechanism is not an issue. There are mechanisms that you can use to finance. The problem is the lack of willingness and commitment to act, or low commitment to act. We have, as you said, our presser on Thursday. When we launch the strategy, we can discuss the same thing again if you're joining. Thank you.
We have Two more questions and then we'll wrap up. One is a written question from Gustavo Capdevila of Interpress Service. And he asks to you, Mariana, what do you specifically refer to when you mention, quote, artificial constraints imposed by outdated economic assumptions, end quote?
Well, sorry, were you finished, Gabby? Yes. This idea that government budgets are the same things as household budgets. You know, a household, if it gets into debt, it must pay back that debt or it will go bankrupt. That is not the same thing as a government budget. Governments do, especially those with sovereign currencies, they have the ability to create a finance, but, you know, it's more than just the kind of, you know, activities through bond markets. It's also the point that if you can then create a multiplier effect, which is really what we talk about, the need to have ambitious, bold public policies that are mission oriented, that increase also the expectations in the business community of where future opportunities lie, but with strong conditions attached to make sure there's a common goal that has a multiplicative power of creating finance that, of course, again, households don't have. And so this confusion between government budgets and household budgets is what I'm referring to, that creates this false idea that there's no money, that you actually have to, you know, say, raise taxes, which of course is important. We should have a progressive taxation system, but the actual constraint is often the lack of imagination of what to finance in the first place. This is why it's important to go back to, you know, Roosevelt's New Deal and the Green Deal that has been talked about today, and really to focus a lot also on the word the deal, but really to remember something that Roosevelt talked about, which we talked about, Dr. Tedros, and a meeting recently, which is the need to experiment and to try. Roosevelt often talked about just try something for God's sake. And so what are, you know, like this is really what both our briefs so far try to do, which is to reimagine a different way to structure our economy with health for all goals attached to it, which can foster new types of public-private partnerships, which then galvanize more finance towards really important goals around the social and economic determinants of health, as opposed to always pretending that there's no money, and then actually money comes again out of the woodwork, lots of it during crisis when it's too late, because, you know, this crisis ended up being much, much worse than it had to be because we didn't properly finance our global health systems.
Thank you. We have a question, and our last question, because we are beyond time, is from Elaine Fletcher, Health Policy Watch. Elaine, can you unmute yourself, please?
Yes, thanks. As Gabby mentioned, this is a very far-reaching brief, and a lot of it could be considered rather pie in the sky. So my question would be, as this is coming out just ahead of the G20 meeting, what would be the 3 top asks that you'd like to put to the G20 around these issues? What would you like to see in their final statement? And I'm wondering if this also revolves around the issues of debt relief and special drawing rights, which we haven't heard much elaboration about. I think maybe closing the circle a little more tightly to the health issue on those questions would be good to, you know, be a good connection to make.
Sure.
Thanks, Elaine. Yeah, over to you, Mariana.
Yeah, I mean, well, you've just named 2 of the very important ones, which in the brief, again, we go more into, which is, you know, the debt relief is also because we know, so the debt relief that we call for, which I discussed, is related to, though, this kind of need for new economic thinking, that, you know, just, you know, increasing the amount of debt into the system without actually realizing that it's precisely also the conditions that were tied to that debt, which reduce the capacity on the ground, is something we have to reflect on. So, you know, this, by the way, is also true more globally in terms of the kind of loans that have been provided to different types of companies globally. This has only increased private debt. You know, and the ratio of private debt to disposable income right now globally is back to the level it was with the financial crisis. So the mechanisms themselves that are often used in moments like these to, you know, try to get out of the crisis just start laying the groundwork for the next crisis. So, you know, that's a bigger point, but it's a very important point, because unfortunately what we're seeing in many different countries is an increase in private debt. But in terms of the public debt, we call for debt relief precisely so this fiscal space in such a crucial moment can be created. And we make very specific points around that. In terms of SDRs, do you want to mention something like that? No? I mean, being able to actually direct the SDRs that are created by, these large lateral institutions is very important. I mean, this point that we need to be directing the finance towards particular objectives is crucial, because otherwise you have SDRs, which in theory are there to help lower income countries. But if they are not structured in such a way and targeted in such a way around, making sure that we have, globally accessible vaccines and, not the current situation of vaccine apartheid, that requires structuring those SDRs in a much more grounded and specific way than simply assuming that the fact that they exist will help us out of the crisis. But I think, this point of also realizing, if we look at the vaccines, for example, there's lots of different vaccines out there, but they were actually structured in different ways. And I don't think there's been enough discussion about that. The fact that, for example, and I don't want to, call out specific ones or make reference to kind of good versus bad, but just the attention to the design detail matters. And we need to make sure we're learning from the positive experiences. The fact that the AstraZeneca vaccine, for example, represented actually strong negotiation between the public researchers at Oxford University and the company on keeping costs low and making sure that we didn't have storage systems that just made them inefficient in hot countries, but also that the IPR was much weaker and so on. These are all lessons that we should be learning from in terms of going forwards, what works, what doesn't. And it's just important in a G20 moment that we don't just use big words like vaccines, and remember that the actual mission is not just having a vaccine, it's making sure that it's, again, globally accessible. And that means not just the solidarity that's required that we were just talking about in terms of making sure they are sent to countries that haven't had the first and second jabs, but also that we produce and innovate in fundamentally different ways in the first place, which limits the kind of rent seeking that we've seen in the past.
Thanks, Mariana. Dr. Tedros, any thoughts on the upcoming G20 and beyond?
Yeah, on the G20, of course, we have to focus on ending this pandemic. So the one focus area should be on how to finance the vaccination targets. We have to vaccinate the world. The target is 40% by the end of this year and 70% by middle next year, each and every country. So G20's commitment to this will be very important. If we cannot be serious about ending the pandemic and at least financing the vaccination campaign, I don't think anybody will trust us if we commit about the future, or investments about preparedness for the future. If we are serious, we start from doing this immediate need or fulfilling this immediate need. So that would be, commitment, real commitment to that, to achieve the 40% by the end of this year and 70 by middle will be crucial and should be the focus. Of course, in addition to that, discussions on pandemic for the future, pandemic treaty, and agreement on pandemic treaty or pandemic agreement will be very important. And then, of course, the centrality of health is now clear. Investment in emergency preparedness, investment in health system in general, commitment to health for all as per this brief will be very, very important. And of course, agreeing or committing to financing those. And one thing that's put forward, the specific gain, is the recommendation from a high-level panel organized by the G20 countries that came up with a set of recommendations and to form a health and finance board which can mobilize resources to fund pandemic preparedness and response. This is a very good idea, and WHO supports this fully. And I hope the G20 countries can agree on this, proposal. I had many rounds of discussions with the panel of experts, and we're convinced that this could be a good support to global health in general, and also to emergency preparedness and response in particular. So I think these are the areas among others. But if you ask me in terms of immediate, it's the vaccine now, finance and achieve the targets, and the pandemic, open the world, that's one. Second is to agree on the G20, the health and finance, financing board, which is proposed by the high level, which can help us to mobilize more resources as per the proposal already set forward. These two could be at the center, and of course the rest of what we have discussed, but the two will show if there is real commitment there, because these are the immediate. Do them today and show that you're serious is the issue. Thank you.
Thanks, Dr. Tedros. Thank you, Professor Mazzucato. To quote you, Dr. Tedros, if not now, when? So with that, I'll wrap up the press conference. To reporters who joined, thank you. We will send you via email the audio file from this presser later today. There is a session at the World Health Summit in Berlin on the Council for the Economics of Health for All, which will be live streamed, which our two distinguished speakers will join, and other VIPs. Hope you can tune into that, which we will also be live streaming on our accounts. And last but not least, we will have a press conference on Thursday. And as Dr. Tedros and one of our reporters from Development Today indicated, ACT Accelerator will be a topic of conversation at that time. So see you there. Thank you again, and goodbye, and have a great day.
Thank you.
Thank you.
Okay. Bella.
Bella?